Yes, doctor. Yes, today we'll speak about brain tumor. As you see in this picture, brain tumor introduction. The major potential of the brain includes the cerebrum and the cerebellum and the brain stem. As you see this structure of the brain tumor, the brain consists of convolution sulcus and corpus sulcus and transverse fissura and the cerebellum and also spinal cord. Next slide. What's the meaning of brain tumor? Brain tumor is a mass of gross abnormal cell in your brain. Many different types of brain tumor exist. Some brain tumor are non-necrosis and some brain tumor are cancerosis. Next slide. As we see this tumor make inflammation of the brain. Next one. What is the classification of brain tumor? The brain tumor classified as a beginning brain tumor. Beginning brain tumor don't contain cancer cell. Usually beginning tumor can be removed and the solidium grow back. The border or edge of beginning brain tumor can be clearly seen. Cells from beginning tumor don't invade tissue around them or spread to other part of the body. Next slide. However, beginning tumor can be pressed on the sensitivity area or the brain and cause a serious health problems. As unlike beginning tumor in most other parts of the body, beginning brain tumor are sometimes life-threatening, and also very rarely beginning brain tumor may become malignant. Next slide. What is a malignant brain tumor? Malignant brain tumor are generally more serious and often is life-threatening. It may also be primary the tumor originate from the brain tissue or secondary from other tumor elsewhere in the body. They are likely grow rapidly and invade the surrounding the healthy brain. Next slide. What is the sign and the symptom of brain tumor? Symptom related to the increase in intracranial pressure, such as decrease in level of consequences, such as confusion and lethargy, and also headache, most common in the early morning and made worse by coughing or straining. Next slide. As we see in this picture, different type of brain tumor and different in different area, like meningioma. There are three area: axilla or coronal and sagittal, and glomia, also axilla and coronal and sagittal, and the petechiora. Next slide. Also, we have a symptoms like vomiting and palpedema. Palpedema is edema of optic nerve and visual distribution. Alternation mental status. And also localized symptoms such as aphasia and personality change as in case of frontal B tumor. And also sensory defected smell and hearing, and also seizures and also motor abnormalities. Next slide, please. As we see, what is the diagnosis of brain tumor? First one, physical exam and also neurological examination, and brain CT scan and MR on scan, brain on the brain, and the angiogram and the spinal tap and the biopsy. Next one. What is the treatment of brain tumor? There are a variety of medical treatment modalities, include the chemotherapy and the radiotherapy are used alone or in combination with the surgical resection. Supportive care includes the steroids and anticonvulsant drugs. And in emergency situation, we can use a surgical operation to treatment the tumor. What is a brain cancer prevention or how brain cancer prevention? Next one. In the real life, you can't prevent the brain tumor. You can reduce your risk or development of brain tumor by avoiding environmental hazards such as smoking and excessive exposure to radiation. Thank you for attention.